is quite popular. But do we really know which form of yoga to follow, which asanas to do, when is the right time, what are the do's and don'ts, how does it benefit us? So let's talk about prenatal yoga. That is the yoga which is practiced during pregnancy. Besides prenatal yoga, there is also restorative yoga and hatha yoga which is practiced during pregnancy. But prenatal yoga form is the most common one. The yoga which is not to be followed is the hot yoga, popularly known as Bikram yoga, which is done in 40 degree centigrade of a heated temperature room with 40% of humidity. It's a no-no because it can cause hyperthermia and even cause miscarriages. So what's the good time to start yoga? The best time for you to start prenatal yoga is in the second trimester, that is the 4th, 5th or 6th month of pregnancy, 14 weeks onwards. In case you have never practiced yoga before or have been off yoga in terms of practice. If you're a regular practitioner of yoga, you can start in the first 3 months itself. Do not do strenuous forms of yoga and do not introduce new forms of asanas, which can be of a hindrance to your health. Then comes the question as to what are the advantages of yoga. Of course, yoga helps to relieve tension, stress and anxiety. It helps to improve the sleep of a pregnant woman as well. It helps to remove or decrease the amount of nausea, that is the vomitish feeling. Headaches also are reduced, backache is relieved, and in addition, it also helps to strengthen, provide endurance and flexibility to the pelvic muscles, which are the muscles which is the root for the normal vaginal delivery. With its breathing exercises, it also helps to build up the stamina to breathe, particularly when it is time of contractions, labor contractions, and it also helps in the shortness of breath. So yoga, if you realize, is a multifaceted form of exercise which is based on focused breathing, mental centering and stretching exercises. So how much is too much? Well, give yoga exercise your own pace. Do not overdo it. 30 minutes of relaxed yoga about 5 times in a week is enough. You must know what are the warning signs of when to stop in case there is any pain, in case there is vaginal bleeding, any burst of water, abdominal contractions, please stop. Make sure that you are wearing loose clothes, you are well hydrated, are carrying a bottle of water for your comfort at all points in time. So which are the asanas to be practiced? So there are these 5 popular asanas. The first one being the butterfly pose, which is also known as the Bhadrasana. In that you know that we sit on the floor and we join the 2 feet in the form of a position of a namaskar, and then we flap our legs. This asana helps to stretch the ligaments of the pelvic muscles, strengthen them, increase the flexibility of the hip joint, and therefore is wonderful to be practiced to help in normal vaginal delivery. The other is the Trikona asana, in which we join our hands right above and we stretch. This asana is very good, especially in the 3rd trimester, because it helps in increasing the flexibility and particularly in shortness of breath and maintaining the stamina during contractions. Then comes the cow pose or the cat pose, popularly known as the Marjari asana. In this, it's a huge amount of relaxation of the shoulder muscles and your back muscles in particular, besides the hip flexibility. This is particularly advised to be done in the 3rd trimester, that is the last 3 months of pregnancy. Then comes the Parvat asana or the mountain pose. It is very good for the neck strain and the shoulder strain and the flexibility of the hip joint as well. And then comes the relaxation pose, which is the corpse pose or the Shavasana, in which we relax, do mental centering, ease out our tensions. And we also connect as a pregnant lady with the baby which is there in our womb. So these 5 asanas, that is the Bhadra asana, Trikona asana, Marjari asana, Parvat Asan and Shav Asan are the most popular poses. The question now is which poses and postures not to do. Anything in which you lie down on your belly is a no-no. Anything in which you lie down on your back, particularly in the last 3 months, which may be responsible for decreasing the blood supply to the baby, is a no. Anything which involves bending your back is a no. Please flex and bend from the hip joint, but do not compromise on your back posture. Any sudden twists are unacceptable. Any acute, aggressive forward bends and aggressive backward bends are also a no-no. So does yoga cause miscarriages? Answer is no. Is yoga responsible for miscarriage in the first 3 months? Answer is no. Are all postures of yoga favorable during pregnancy? No. Are there some warning signs as to when to stop doing yoga? Of course, yes. And are there certain conditions in which we should not practice yoga? Of course. In case you are a patient of premature labor in the past, or you are threatened for premature labor, or you have a low-lying placenta, or you have a water bag burst, or a potential of having a water bag burst, if you have twin pregnancy which is very precarious, you have to have your doctor's advice before you practice prenatal yoga. So what does your average class look like? Well, there are breathing exercises, then there are stretching exercises, then there are asanas or postures, and then there is cooling down period and relaxation. So are all breathing exercises good to go? Well, Kapalbhati has to be done a little slowly because you're compressing the organs, but Anulom Vilom, that is your nasal breathing, and Brahmari are good to go. So this is all about prenatal yoga, yoga in pregnancy. This is Dr. Puja Dewan, your gynecologist, right there with you all the time for all practical advices on this very channel, Dr. Puja Dewan Gynae Chat. Subscribe to this channel, share it with others, like this video, and do comment in the comment section. Thank you. Bye-bye. Stay good, stay healthy. Wish you a healthy pregnancy and a healthy baby.